So you have this question. Most of the time, the question will be long. It's your job to read them carefully. Don't spend too much time. Look for buzzwords and then circle them, make your diagnosis, and move forward. So, what is the problem? The nurse is caring for a client diagnosed with hypothyroidism. Client was prescribed levothyroxine, right? For each of the teaching provided, click to specify whether the teaching is appropriate or not appropriate. What is the summary? I have a patient diagnosed with hypothyroidism, and the patient is treated with Centroid or levothyroxine. The nurse is providing some teaching, so you have to look at it whether the teaching is appropriate or not appropriate. This is the same thing selected apply, but it's different. You're just changing it a little bit. It's the same thing, is appropriate or not appropriate. This one, I said it that you don't lose any points. So you have to come up with the content and say levothyroxine is Centroid. And there's certain things you have to know, and it's in the question or the answers. Take it on an empty stomach in the morning. Yeah, because it's what you do. They are appropriate. And you take it 1 hour before meal. Yes. And you take it 2 hours after meal. Yes. So 1 hour before meal, 2 hours after meal. And then you take it on an empty stomach. Whichever one you want. Take it with calcium antacid to help absorption. This is a trap. Antacid never help with any absorption mechanism. Every time you see antacid, see that is an enemy for you. Antacid is never a friend. It prevents absorption of certain drugs. It changes the acidity of the stomach. So for this, it's not appropriate. Therapeutic effect is immediate. There's no medication that your therapeutic effect will be right away. It takes some time for Centroid to build up. So this is inappropriate. Need to stop medication when pregnant. That is not true. When you're pregnant, you rather need more thyroid hormone because of the stress. Therefore, this is wrong. They need to take their thyroid hormone. They need a dose, extra dose for the stress, um, to take care of the stress. Okay, they need extra dose of the thyroid hormone to take care of the stress. Therefore, because of that, we need to continue to tell them to continue to take the medication. So this is bad teaching. And this is the way selected apply would be. Sometimes you lose a point, sometimes you don't lose a point. But this is the classic way. So as you learn, start thinking clinically, like teaching, education, they will set it this way so that you can see whether this is appropriate or not. It's the same thing, selected apply, which is applied to the question. So straightforward question, it's a pharmacological question, but that's the way you will see it. Take care of yourself and have a good day.